4 cases of the UK mutation of the coronavirus have now been discovered here in San Diego. That new strain is thought to be more infectious than the standard version of the disease, but not necessarily more deadly. Ava Zamaris breaks down what we know about this new variant and what scientists are still trying to figure out.
The fight against COVID-19 intensifies as cases continue to climb, and now multiple variants are circulating globally. One new variant, which the CDC says emerged in the UK a few months ago, has been detected here in the U.S.
Not necessarily a reason to sound the alarm, but definitely something that we have to watch.
We've learned from the CDC viruses constantly change through mutation, and new variants of a virus are expected over time. Sometimes new variants emerge and disappear. Other times, new variants emerge and start infecting people. To break this all down, we spoke with Dr. David Bannock, the hospital epidemiologist for UConn Health.
Most of these mutations are not very significant, but sometimes there's enough mutations in place to actually change some aspects of the virus. What's been seen so far is that this particular variant of the virus seems to be highly transmissible, so it can spread quite easily.
What we do know from the CDC is currently there's no evidence these variants cause more severe illness or increased risk of death. What we don't know and what scientists are working to figure out is how widely these new variants have spread or how the new variants differ.
I think this does really heighten the need to do this next level of testing, what we call genomic sequencing, to really understand when these kinds of changes are occurring and if they're occurring with more frequency and how they're impacting the overall spread of COVID-19.
And as for the COVID vaccines being administered across the country and the world,
the scientific evidence doesn't suggest that the vaccine would be less effective per se. Vaccines have an effect that allow the immune system to attack multiple different ways against the virus. So one change like this wouldn't necessarily impact the overall effectiveness of the vaccine.
Ava Zamaris with that report. Doctors are telling people to take the same precautions against this new strain as the normal coronavirus, including social distancing and, of course, wearing a mask.